my friend penned quite simple prose and sweet poetry.
Hello everyone, I'm Dr. Christopher Hung Vu, and our show is Future Healthcare A to Z. This production is a sequel of the series America's Healthcare Crisis, which was produced at Access Los Altos 20 years ago. And both productions are intended to provide an open forum for the expression and exchange of ideas that might help improving the quality and efficiency of healthcare delivery in our country. And the topic of discussion for our program tonight is the future of Obamacare. And to help me with this subject, I have the pleasure of having the participation and the contribution of Dr. Kim. Dr. Kim, who is my partner and the co-host for the show. And also a live audience of very healthy, energetic, and good-looking talents. And the first thing I'd like to do is to ask Dulce to read the provisions of the Obamacare.
The Historic Affordable Care Act, or Obamacare, includes the following provisions. Number 1, mandatory medical insurance coverage for every American citizen. Number 2, more equitable share of the expenditure. The rich pays more, the poor pays less. 3, subsidies for the poor, the disadvantaged, the elderly, the low-income groups. Number 4, risk pool and choices of many insurance plans according to needs. Number 5, those patients who are happy with their current plans do not have to change. Number 6, tax incentives for both employers and workers to encourage participation. Number 7, no exclusion of pre-existing conditions. Number 8, eliminate ceiling benefits cap for catastrophic illness. Number 9, of coverage of children and their parents plan up to 26 years. Number 10, elimination of donut hole drug coverage for Medicare patients, insurance companies to reimburse rebate premium when they have not spent enough to cover care. Number 11, mandatory electronic medical records, EMR, to facilitate communication and reduce duplication of services. Number 12, quality control of improvement of care through benchmarking and performing grading process. Number 13, improve coverage for preventative and mental health issues. Number 14, incentive for providers to be more cost efficient.
Thank you, Dulce. As you know, this is a very major concern for everyone in our country. And I'm a strong supporter of the president. He's a great president. And he has created this act, which is very important in our lives, in days to come. But there are a few concerns that I'd like to communicate with you right now. 20 years ago, the healthcare expenditure in our country was 14% of the GDP, which is the gross domestic product. And now, 20 years later, it has increased to 17.5%. And we are the country in the world that spend the most money in healthcare. And we spend an average of $8,000 per capita compared to Canada, which is about $5,000, and South Korea, where Dr. Kim came from, only spend 7.4% of the GDP on healthcare. And as far as efficiency and quality, I have another study here which is called the Bloomberg Best and Worst Efficient Healthcare among the countries. And the number 1 is Hong Kong. We rank number 46 among the 48 countries. So that's very low. The efficiency and the quality of care is poor. And the quality of care is judged by the life expectancy and the infant mortality, among other criteria. So the first question I have to ask Dr. Kim, what is your take on this? How do you think that the healthcare delivery in our country is going?
I think it's going in the right direction, but except there's some holdbacks by the interest groups like insurance companies and pharmaceutical companies.
You think it's going in the right direction?
At least it's a first step.
So how can we spend so much money?
I think it's the system that's based on the greed of big corporations, and we need to have a better value, but they're just talking about the better system without any value. So
okay, let's talk about what we call conventional medicine, right? Conventional medicine is what we have right now. And let's show the slide, Mark, our director, so we know it. This is what I call conventional medicine. It is big, humongous business, questionable science, and minuscule art. There's three parts in the healthcare delivery. And the first part is business. It's a very big business. It's 17% of the GDP. That's 2.8 trillion, something like that. Many, many zeros. And the second part is scientific methods. And to me, one of the very big concept right now is called evidence-based medicine. In all the methods of analysis of quality of medical care. But to me, evidence is a very difficult word to use, because the part that is not easily proven by any method of measurement is the emotions. The patient comes in, most of the patients I see every day is very, very anxious. And their emotions create a lot of stress in their lives, in the environment, and in my office. And we can measure the blood pressure. We can measure the hormones level. We can measure different things, but the emotions of patients, how are we going to measure that? There's no evidence of that whatsoever that is easily documented. And when I met Dr. Kim about 2 years ago, we talked about the experience that we have had in our practice. And it was amazing to me that he has shown me very clearly that there are better ways of delivering healthcare to the patients. Very effective, very high quality, good outcomes, with very, very little money. And I have been asking myself, why is that it costs so much money to give care to the patients in the conventional way. And one of the thought I have is that instead of doing what they call the double-blind study, which means that you give the medication to one group and the placebo to another, and compare the results of those two groups. Maybe you should have a different kind of analysis, comparing the different pathways. In other words, you can ask the Kaiser Permanente to analyze the outcome of a group of patients, the way they do it. And then Harvard will do another study. And then the South Korean, maybe give their way of giving the care to the same group of patients and compare the results. Not double-blind, but maybe triple path. What do you think?
Yeah.
Would that be a good idea?
Yeah, that's a good idea.
I was amazed to find out when I visited South Korea with my friend Dr. Kim that they had much, much better way of giving care with very, very high positive outcome with very little resources. And I wonder why we don't do that here. I mean, so we're going to discuss more in details about the aspect of care. The cost issue is enormous. I think that it will affect the economy in a very big way, because even years ago, in the 60s, President Nixon was saying that we are going broke because our companies cannot compete with the other companies because their healthcare expenditure is too high. How are we doing? Okay. Anyway, we are 4 decades after, and the expenditure continues to increase every year. And as you see, we don't have the best quality care in the world. So let's talk about the ways to improve that. And that's what the intention of our production here is about. And I'm very honored and happy to have the help of the professional staff at KMVT. And I think that this is going to be a helpful way to communicate with the public about the status of our healthcare system. Now, let's see. Normally, the way we deliver care in this country is that you get sick. You go to see the doctor. He will ask a few questions and give you a prescription, sometimes very expensive drugs that you cannot afford. And then maybe order a serial test, blood test, x-rays, and sometimes very expensive procedures like CT scan, MRIs. We have seen our practice dozens of patients every week, right? We come in with the bill from the hospital where they were hospitalized for 1 week, tens of thousands of dollars, and then they go home and they have home care delivery, a big, big expense again. And then you still saw them, right? You saw them because they're not happy with the results. And then you gave them the kind of care you get. Tell us about what you do for them when they came to the office.
Yeah, I can give them a instant relief of pain or other recovery of a range of motion of their.
So you talk about the subjective complaint, which is the pain. Pain management is the key service that we gave to our patient. We are giving to our patients in the office. And it amazes me that Dr. Kim has been able to relieve their acute or even chronic pain within very short time. Talking about 3, 4, maybe 5 sessions of acupuncture. And they are happy, very cost effective. And then I feel that, in my experience, most of the patients come in with a minor injury or illness, common colds, cough, pain here and there. Just by expressing my concern and my sincere understanding of their worries, already start to help them healing within the first minute of my conversation with them. Very seldom do I have to go to order expensive tests or very expensive drugs. And most of them get well. They have the ability to recover very quickly. And why is that? That each time a person goes to the emergency room for chest pain, for whatever worries they have, they come out of the emergency room of $10,000 workup, and then referrals to the specialist. All those things to me are worrisome because they don't really address the issues. Now let's talk about the way we can analyze the situation in more comprehensive way. Now the first thing is that I think that one thing I want to ask Dr. Kim is that we have the primary care, which is really the foundation of basic care, right? Prevention, health maintenance, and acute care. And you have specialized care. What do you think about the extreme imbalance between the quality of primary care versus specialized care?
I think it's a matter of education of the general public so that they can have better knowledge in terms of how to navigate their health disease treatment or health maintenance.
Yeah.
And
well, the concern I have is that right now we're spending 17% of the GDP on healthcare, and we're adding 40 million more patients into the system. The system is going broke already. 40 million more patients are going to really put a very big burden into the economy. And how are we going to spend more money into taking care of those patients? And I think that we have put so much emphasis and focus on the specialized care that we forget that we need to have a very solid, strong foundation for primary care. In my opinion, one of the suggestions I have is we can have different levels of care, starting in the neighborhood. Like have a medical care post, just like the post office, for 500 patients in the neighborhood, in each neighborhood, which is manned by low cost training workers like medical assistants. The ladies here are helping taking care of our patients very effectively every day. And it's very cost effective to train them for a short period of time. Instead of 4 years, 8 years of medical education, we can teach them the basic care for the population of patients with minor illnesses at the very first level of care. And then we refer the patients to the second clinic, which have more sophisticated way to diagnose and to treat, and then so forth and so on, the third level and the fourth level. We have to stratify the patient so that each patient has the way to go to the place where it doesn't cost too much to take care of them in terms of prevention or minor illnesses, and then a very in case they need, they can go to the emergency room. But if you add 40 million patients more who develop any kind of symptoms and run to the emergency room, it's going to cost enormous amount of money. And that's not a way to do it. So that's one of the suggestions I have. I don't know whether it's going to happen or not, but I think that's the way I can see that we can improve the expenditure of healthcare. Now, the other thing is that the administrative cost of care delivery is enormous. In some insurance company, it costs 21% of the whole budget to do paperwork. You spend a lot of time doing billing, right? Billings and waiting for money to come. That's totally inefficient. Why don't we scrap? I mean, we just throw the whole billing and documenting charts away and just salary they provide us. And then we don't have to have the, but right now we have added a group of workers, full-time workers, who answer a question about how to enroll into Obamacare. I mean, it's just totally ludicrous, you know, because we spend so much money in a vacuum. I think you just pay the providers, just like the Canadian, the French, the Australian, so you don't have to worry about billing and waiting for money to come. Why don't we do that?
I think it's a difference is the value system, the philosophy. After I read your article about will Obamacare work, I thought that, and then there's news that there are more like 8 million more people joined after this Obamacare Act.
In California alone, 8 million.
So it means we need to create a system that we can afford. We cannot just dragged by this greed-oriented system.
Yeah.
So
well, we're talking about the efficiency of the administration. Now let's talk about what we call greed-oriented free enterprise medicine, right? In other words, we have a humongous business. It's called the medical industrial complex, where, you know, at the flip of the pen, the providers can order MRIs and angioplasties and procedures that cost hundreds of millions of dollars. And they don't get anywhere because they don't need them. I mean, 500,000 angioplasties are unnecessary and are performed anyway every year. Can you imagine? That is called the fake economy. That giving jobs to people who don't think are not necessary. So are the tests. The tests are ordered because people want to make money, because they fear malpractice. If they don't order the tests, they may be sued, or they may be reprimanded by the peer reviewers, or else they may have patients complain because they want to have those tests. In my experience, more is not better. Sometimes more is just more confusion. You have a lot of information, but you don't help the patient in resolving their problems. We can have one of the major authority in orthopedics and sports medicine. I don't remember his name now, but he says that the MRIs, for example, which cost a lot of money to perform, can give false results and lead to unnecessary procedures. And that's going to complicate the pictures even more, because if you do something that is not necessary and cause a side effect, you have to take care of the side effect. We go into the circle of waste and harmful things that we do to the patient instead of for them. We do things to the patients, not for them. You know that, right? I mean, I am amazed and I'm delighted that you can help so many patients for a very simple way of treating them. And that's how, you know, the South Korean doctors, I met them, and they do what they call functional medicine. Not only they treat the subjective symptoms, but they improve their functions, which is very crucial in analyzing the outcome, right? So why don't we spend some money into studying the different pathways that may be more helpful and less costly, like acupuncture, like herb medicine, like physical therapy, like homeopathy, and other type of resources that we can spend. And we would like to go back to this issue on a different show, where we talk about integrative medicine. Can you show the slide on about integrative medicine? integrative medicine is the usage of resources that is appropriate and the best of science, proven not only by evidence but by other criteria, and the art of medical practice, which is really lacking in the conventional way of practicing medicine. Medical practice is really an art and a mission that we are not doing very well in our conventional medicine. How are we doing? Are we running out of time? Okay. Let me ask one of you here. Anybody is sick recently? Or anybody you know in the family that is sick? No? Everybody's healthy? You're lucky. If you're sick, you can go broke. I mean, you get out of the emergency room. The next day you have a $10,000 bill. I beg your pardon?
Just for one visit.
Yeah. So you mentioned that to me that your mom doesn't have a primary care doctor? Doesn't have a family doctor? Why? Go to the microphone. Why doesn't your mother have a primary care doctor?
I'm really not sure. I'm not sure.
Why does she go for care if she's sick tomorrow?
She just goes to the ER.
Emergency room?
Yeah.
40 million patients are going to be added to the system. And if they get sick, coughing or have fever, they go to the emergency room. You know how much money do they spend on that? So why don't we have a better primary care system to deliver care for them? You can be trained to give care to those patients, right? So I'd like you to discuss that with your family members and find a better way. We don't have to run the emergency room. We don't need specialists. There are way too many specialists. Overpaid, overvalued, and not really giving the kind of needed care that we all have to get when time comes. How are we doing? How many?
30 seconds.
Okay. So I'm wrapping up this discussion today. And thank you for watching. And I hope that you can get some useful information you can use in the understanding of our healthcare delivery system. And hopefully, with the successful implementation of the Obamacare and the understanding of the basic problems of our system, we're going to have a better care for everyone. So I'm Dr. Hung Vu. Our show is Future Healthcare A to Z. It can be watched on YouTube, on our website, which is Future Healthcare A to Z. Thank you for watching. Good night.
My friend Pen, write simple prose and sweet poetry, expresses joy and sorrow, hope and fear, helps me find answers.